Dentist, Logan, Utah, Doug Smith. How to relieve pain in your teeth.
My name is Doug Smith. I'm a local dentist here in Logan, Utah. And for the next few minutes, I want to just discuss pain relief for the dental patient that has a problem with pain in their teeth, need to get in and see their dentist, but maybe need to just, something to tide them over until they can get in. Pretty common occurrence. So I made a little list here. Let me just discuss each one. The first thing you can do to relieve pain in your teeth, there's several things. First would be a topical agent that you can pick up at the drugstore. And this would be known, common names would be Oragel or Ambisol. These are agents that contain a benzocaine ointment in them, and that's an analgesic, and it's also, it basically numbs the area. So if you have a bad toothache, you can use these agents to topically swab on the tooth and around the gum area that can help relieve the pain. Second thing you can do is pills, over-the-counter medications such as ibuprofen or acetaminophen, and that's just another name for Tylenol. Ibuprofen comes in many forms. Name brands would be Advil and Motrin. These two drugs can provide a lot of pain relief and are typically prescribed even in office to relieve pain versus narcotics. The beauty about ibuprofen and acetaminophen, they both cause relief pain and also are considered what's called a non-steroidal drug, and so they also help decrease inflammation. And so that can be very helpful. Oftentimes I'll have people alternate these two drugs. If you take, you can take up to 800 milligrams of ibuprofen, and that's 4 200 milligram tablets that are over the counter in the typical things you can buy at the store. You could take 4 of those every 6 hours, and I usually suggest alternating with Tylenol or the acetaminophen every 3 hours. So if you took 4 ibuprofen, gives you an 800 milligram dose, 3 hours later take 2 extra strength Tylenols, and then in another 3 hours alternate back to the ibuprofen, so that every 3 hours you're going from one to the other. That will provide a lot of pain relief. The third thing on my list that I wrote down was oil of clove. Clove oil, commonly referred to as eugenol, which we actually use in the office. It's mixed with a powder to form a paste that we actually can put in your tooth, and that actually does provide a lot of pain relief. If you can find a bottle of clove oil at the store, you wouldn't have a powder to mix it with, but you could put it on a little cotton ball and then place that inside the tooth, and that will actually help provide pain relief until you can get in to see the dentist. If you have a bad tooth and it's caused from the nerve, say the decay has gotten into the nerve and your tooth is what's called necrotic or dead, the nerve's dying in the tooth, that will cause a lot of pain and you actually can get an abscess. If that's the kind of pain you're having, it's kind of a throbbing, aching pain. Sometimes cold water, ice water, will actually relieve the pain. If heat makes the tooth hurt, you know it needs a root canal or the tooth needs to come out. And so you can sometimes hold cold water in your mouth and that will relieve the pain. Another pain a lot of people have in their teeth is just simply from heat and cold. If they go outside and breathe in air, and it's caused from gum recession around the roots of the teeth. And for this kind of pain, a lot of times you can simply go buy Sensodyne toothpaste or a sensitivity toothpaste at the store and use it on a regular basis, morning and night, and that will help to decrease the sensitivity or pain in your teeth. But make sure you follow up with a dentist just to make sure that is the cause of your pain. Another thing you can do to relieve pain is warm salt water rinsing, and even using Listerine. These kind of things act like an analgesic and can relieve pain in your mouth and in the teeth. Another thing I just mentioned here is if you have a filling that has come out of your tooth or you have a hole in your tooth and it's causing the pain, a lot of times you can just use sugarless gum and soften that up, chew it up, and then actually put it inside the hole of your tooth. Make sure you rinse your tooth out good and then just take a piece of that chewing gum and actually push it down into the hole, and that will actually cause the hole to be filled. It acts like a dressing so that the air and the elements aren't getting to the tooth and causing you pain. And so that's a really easy fix to fill a hole in your tooth. And that will actually work too if you have a crown that falls off and the tooth's exposed. You could put a little gum up in the crown and then just push it back on, and that will usually hold it on until you can get in to see the dentist. So those are just some things you can try to relieve pain until you can get in to see your dentist if you have a toothache or pain in your teeth. Thank you.
Don't continue to suffer with pain in your teeth. Call Doug Smith today. If for some reason we're not able to answer right away, leave us a message. If we don't get back with you within 10 minutes, we will knock $100 off your visit. Call Dr. Smith today at 435-752-4882.